Dr. Strom, you're the Chancellor of Rutgers Biomedical and Health Sciences, or RBHS. It's a pleasure to have you with us today.
Pleasure to be here.
So can you tell us how exactly global health concerns are the same and how they are different across the world?
Yeah, global health, by definition, is health in the world. It's the health of populations across the world. Part of that are things that affect large numbers of people. Part of that are things that are access to care and wanting to give people access to care. It affects people in the developing world. It affects people in the developed world as well. We've really moved away from the term global health. Moved away from the term international health. Moved toward the term global health.
So you said it affects people in the developed world as well. How does it affect us here in New Jersey?
Well, it affects us enormously. So, a classic use of global health is infectious disease. And obviously, as we look at Zika, which was just discovered in elsewhere in the world, a major issue for the Olympics now in Rio, has just spread to Florida. We expect it will emerge up the rest of the coast, up to New Jersey. But the global health is also broader than that. It used to be that it was primarily infectious disease. Nowadays, more and more global health focus on chronic disease. So in the same way as our major causes of death are cancer and heart disease, in much of the developing world, the same causes, the same diseases are major causes.
So from an academic and clinical practice perspective, how can we champion for global health here at home?
Well, we are enormously interested in global health and RBHS. We have just hired a superstar who we stole from Harvard to be head of global health. He's done a lot of work in Africa. We hope to have a lot of students involved. We hope to have a lot of faculty doing a lot of research involved. There is a lot of that, in fact, already underway. Almost every one of my schools has a Center for Global Health. His job is really to tie it all together and to raise the visibility of Rutgers worldwide dealing with these questions.
So as global health crises arise, how is RBHS uniquely positioned to respond?
We're really uniquely positioned in a number of ways. We're very large. We have a lot of talent across many fields. And Rutgers, in general, is as well. So thinking about the Zika epidemic, for example, Rutgers has specialists in mosquito control that are not part of RBHS, who are a key part of it. On the other hand, RBHS has experts in infectious diseases. We have experts in chronic disease, meaning things like heart disease. Cigarette smoking causes heart disease. We have huge experts in cigarette smoking. As the epidemic of smoking decreases in the US, it's increasing in other countries. And we can help to change the way people smoke in the rest of the world.
Well, thank you so much for working for global health for all of us.
Sure. Very much my pleasure.